If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is the best medicine for type 2 diabetes available? Answer by Akash Prabhu. Diabetes is a lifestyle disease, and by lifestyle disease I mean the disease which we ourselves invite to hit on our body as a result of our lifestyle. There is no miracle drug like penicillin which would kill the disease at once. Generally the drugs used in diabetes management, mark my word, management not the treatment, are for all purpose and intents targeted at lowering the blood glucose levels. The aim of most drugs is to lower blood glucose levels, and this is one important aspect. Usually type 2 diabetes can be classified as non-insulin dependent and insulin dependent. So the non-insulin dependent cases have adequate amount of insulin, as the normal healthy person has, in their body, but due to some factors like hyperlipidemia the insulin doesn't function at its 100% capacity and the result is increased blood glucose. The insulin dependent is one where body due to some unknown factors is unable to produce enough insulin to convert the required blood glucose into glycogen, and again the blood glucose shoots up. Metformin is the first line of drug because it doesn't interfere with insulin production of the body and functions directly on blood glucose. What recent evidence suggests is, diabetes can be effectively managed with lifestyle modifications. The WHO recommends these are most convenient and commonly prescribed modifications. It is recommended you visit your physician and let him chalk down a personalized plan for you depending upon your daily lifestyle and let him decide the medicines. Self-medication can be dangerous. Answer by Rahila D. My uncle was suffering from type 2 diabetes. He is still suffering now, but it's under control. Last year, in routine company checkup, his fasting sugar was 380 and post-lunch sugar was 550. His physician recommended him to immediately start taking anti-diabetics to bring the sugar under control. His urine also showed plus sugar. Since his father was also a diabetic and suffered from diabetic foot, diabetic neuropathy and kidney failure, my uncle was dead against taking allopathic medicines. So against our all wishes he visited an Ayurvedic center called Gayatri Art in Mumbai. The drive over there gave him a list of things not to eat, basic warm-up exercises and some alkaline water to drink, but no medicines. We all again requested uncle to go some other genuine doctor, but he was unwilling to listen to us. So after avoiding wheat, sugar, white salt, potatoes, non-veg, fish and eggs were allowed, fruit juice and doing some warm-up exercises twice a day and walking daily for 30 minutes 2 times a day, we repeated his blood sugar after 10 days. The sugar had come down to 190 fasting and 350 post-lunch. The drive then started him on a herbal tablet, green herbal tea and some powder at night. After 15 days we again repeated the blood sugar, and this time fasting was 120 and post-lunch was 190. My uncle now walks 30 minutes 3 times a day, has regained weight and stamina and has no complications from diabetes like diabetic neuropathy or diabetic foot or frequent urination at night. He wakes up only once at night and is healthy. So after my experience I can say Ayurvedic herbs are best, provided we do all things recommended by the doctor. The medicines have also helped to reduce his cholesterol, heart block and varicose veins. His BP is normal and his cardiac physician is also happy. Answer by Anika Khan. For more details, contact our hospital, http://4slana medical ca/